And one of the things that we really love about the Radiothon is getting to learn about some of the things that are, more behind the scenes. We talk to doctors and nurses and patients, and we hear about the stuff that happens in the operating room and in the treatment rooms. But so much of what goes on at the hospital happens outside of those rooms. And Dasi Schlup is with us with MU Healthcare. We've talked to her several years, and you always give us some great insights about some of those other things that we maybe don't know so much about.
That people don't think about.
Exactly.
Right?
And so kind of give us maybe just a general view of what it is that your department, the social workers program, tell us what you guys handle.
So our role is to see every admission and to help parents start acclimating to the fact that they have a very sick baby and that baby is not going home with them, which was not the plan, right? Everybody looks forward to having a baby. They have the fantasy of what it's going to be like, and suddenly they're thrown into a really heart-wrenching situation. So we try to help them adjust to the environment, help them make decisions, sometimes very difficult, juggling needs at home. They could have other children. Sometimes they have jobs with unpaid leave, and so they have those bills that's unexpected. Moms can't go back, whether they have paid or unpaid leave. They need to recover. Right. Sometimes their baby's in the unit so long that they only get so many weeks off, and do they use it now while the baby's here, or do they wait till they take the baby home so they could have that private time with their babies without all of us hovering? There are financial challenges. They have gas expenses or food expenses, or if they're staying in town, Ronald McDonald House is full. Hopefully it won't be as much now that they're expanding, right. But then they have to pay for hotels if they can. There's just so much that they have to think about. Sometimes it's special equipment or even special formula. And, that was a real problem last year. Just getting that special formula was really hard. So, it's just really challenging. There's no easy way to get through this. So we help them with those logistics. Not any mom in that unit does not experience guilt. They all feel it, no matter if they've done everything right. They question themselves. They feel, I must have done something wrong. So helping them process with that, helping communication with the team, setting up meetings all the time to help enhance the communication. People don't realize how long their baby could theoretically be there. And it's hard to imagine. And they feel very isolated. They may have the best support system, but unless you've been in that unit and really experienced it, you really have no idea what it's like. And so it's hard to get that real support, compassion, with that experience.
We mentioned this earlier this morning, not even as specific as what you're talking about, but it sounds like the people in the hospital that answer the questions that people don't even know they're going to have to ask.
That's right.
And it sounds like that's kind of a fancy name for what your department does.
Yeah, a lot of it is helping, like you said, ask the questions they don't know what to ask.
Yeah.
Making sure they understand what they're being told. It is so overwhelming. They could lose the information after the first sentence of a conversation. Yeah. One thing that they hear suddenly stops the brain from twirling, and it's, foreign. Who thinks about that stuff? Yeah. I always think if I was talking to a mechanic, I would have no idea what they're talking about, because that's not my world.
Right.
This is our world. We're comfortable with it. But when you think about being thrust into a world and not knowing these people who are taking care of your most precious person and just putting almost a blind trust, that's really scary.
Interesting. Dasi Schlup, who we're talking with, a social worker this morning, and kind of give us an insight on some of the, it's all behind the scenes, but kind of outside the operating room and that sort of thing. We were talking a little bit before we turned the microphones on. What's one of the things that you guys are focusing on now, maybe a struggle that you're trying to take care of with the families?
So one of the things that, while on one hand we're so thrilled with the progress we make, we're also saving babies that are very, very small, as I'm sure you've heard, and end up needing continued high-tech care when they go home. So they are discharged on home ventilators, and the demand of that kind of care is impossible for any family with even the best support system to do. And so we do have to get private duty nursing in the home, and that is so hard. There just aren't enough nurses that do that. And it can extend the stay in the NICU for months to find nursing. So we have to get at least 12 to 16 hours, if not more, because they have to sleep or they have other kids, or, you have to be vigilant when your baby's on a ventilator, and learning all the equipment and how to troubleshoot, because if there's a snowstorm or something, the nurse can't show up, if something happens. So that has been one of the biggest challenges right now, to getting babies out of there once they're ready.
I can only imagine just being a scared mom in the NICU with my baby there, and just wanting you or one of your team members to be like, okay, stay by my side the entire time, because I have no idea what I'm doing, and you guys help navigate it so well.
It is. It's a good word, is navigation, because it does take you into a place you would have never known existed. So many people say that I didn't know it was like this. I've seen it on TV, which is not quite the same.
Right.
And they think, oh, it's not like this. And then, feeling isolated and separated from your baby. I mean, we're supposed to take our babies home, right?
Right.
It is heart-wrenching. And some people are hours and hours. We have a baby right now from Springfield. I mean, can you imagine that getting back and forth? It's so challenging. Even if there's assistance, whether it's charities or, Medicaid pays for some, it's still not enough.
Right.
It's just never enough. And then worried about the kids at home, or worried about the job, or the animals. We have people who farm, or, need to work, self-employed. They can't leave their work to somebody, because there isn't a somebody. It's all them. So, there are so many challenges on top of the emotional drain and every challenge that they've never met before. To think about, we often have challenges that we've met before, and so we know what works, how we cope with those things, and we can draw from that. There's nothing like this that you can draw from.
Right.
It's just no comparison.
Yeah.
And that makes it so hard for people to just get through the system, which is a lot of what social workers do, is just help with that process.
Okay. Well, we talk a lot about the folks who've been with us for 18 years. This is the 18th Radiothon, and the folks who have given all that time. You've seen a lot of the changes, and you've seen some of the things that money has gone towards. We're talking to the folks who are in their cars this morning and saying, okay, we need to keep donating for the things that are still to come. What would be your message to those folks, just to try to convince them about the importance and the need of keeping the money coming into Children's Miracle Network?
Sure. So I think it's really hard for people to understand exactly what we're talking about, the dynamics that our parents are going through, and anything that can help make that journey a little easier with contributions. Anything, little things, even a little bit, is such a huge difference. Besides the financial piece, it shows a sense of support, that the people in the community are thinking about you and knowing that you are going through a hard time. It's like I said, it's very hard for people to understand, and that, money that's donated and shows that you really have them in their thoughts and really want to help.
And while it can be an isolating experience, that money, that donation is almost like a little bit of a warm hug.
Yeah.
Going, it's okay, we got you. We don't know what you're going through, but we'll be there every step of the way.
And it's such a good feeling to give that,
Mm-hmm.
People always say, what can I do? And they really mean it. So this is something you can do, and it makes me feel good when I give. That's a good feeling. I feel like I'm gifting something that's important.
Giving is important to the receiver. It's just as important to the giver, isn't it?
Absolutely.
That's great. Dasi, so great to visit with you. We always learn something new when we talk with you. So thank you for taking the time. We appreciate it, and hope you have a great rest of your day, all right?
Thank you, and thanks for doing this.
Our pleasure. Our pleasure. Once again, Dasi Schlup, social worker at the hospital, kind of giving us that insight of those things. As we said earlier this morning, the questions that nobody knows to ask, they know those questions, and they know the answers to most of those questions. And if they don't know them, they're going to find them and just help support. We talked earlier this morning about when you give a donation, that's kind of, as Liz said, you're giving them a hug. I was thinking, putting your hand on their shoulder. This is pretty much the group of people who do that, who put the hand on the shoulder of these patients at the hospital and their families. So when you donate, you are supporting Dasi and all the folks that work for her. So we would encourage you to grab your phone this morning before the day gets away from you and become a miracle maker. It's a great time to do it because we have an anonymous donor who is tripling whatever it is that you give. So you become a miracle maker for $20 a month. That becomes $60 a month. That is money that Dasi and her folks can use to give that hug to the patients and to their families who don't have any idea what the next day is going to bring them. 866-970-4483. 866-970-4483. Become a miracle maker with the Missouri Credit Union Miracles for Kids Radiothon on today's Best Country, Clear 99.